good because I can see you the whole time. How are you? You look great.
Good. It's good to be with you. So yeah, people are asking me where to see this, and I told them they have to go to Facebook and go to Living Spring Medicals. Is that right?
That is correct. That is correct. All right, we are live. Hello, everyone. Good evening, good morning, good afternoon, depending on when and where you're watching this Facebook Live. This is the face of Dr. Tolulope Benton. I'm the CEO and co-founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you're watching live, hashtag live, watching replay, hashtag replay, I am honored and excited to have my guest, Dr. Atoosa Kourosh. Did I say that right?
Kourosh.
Kourosh.
That was close.
And we're having the conversation today on Doc. My daughter has really bad seasonal allergies. Any options aside from medications? Thank you so much, Doc, for coming. How are you doing?
Thank you. It's wonderful to be with you, Dr. Tolu. And it's actually really exciting for me to speak with other local integrative and holistic practitioners and doctors that believe in holistic wellness. So yeah, there are lots of options, and I'm happy to speak with everyone about what they can expect and what's out there and the new innovations in allergy testing and treatment.
Awesome. So Doc, that being said, can you kindly introduce yourself? Who are you and what do you do?
Of course. Yeah, I'm Dr. Atoosa Kourosh, and I'm board certified in allergy and immunology and in pediatrics and in public health. And I'm also a board certified patient health advocate. I'm also board certified clinical hypnotherapist, and I'm a yoga therapist registered with the Yoga Alliance and the International Board of Yoga Therapy. So I have a lot of different certifications and backgrounds, but basically I'm an MD, and I have a holistic practice style that incorporates functional and integrative medicine. And I do my best to approach the patient in a whole fashion, using their whole environment as their history and their whole background, and understanding what their goals are and working in a collaborative way to get to their goals, using all the technology and wisdoms from all the cultures and medical practices that have been validated through scientific means. So there's modern scientific Western medicine traditions. There's all sorts of Eastern medicine and cultural medicines from all over the world that I've studied, including Ayurveda. And so I bring all of that to bear on helping patients heal. And I also use nutrigenomic modalities, including genetic testing to figure out what's the right supplement profile, exercise program, diet for them, and what if anything is predisposing them to either allergic or autoimmune disease, and how we can counter that. Because I believe, and nutrigenomics physicians will tell you, that our genes are not our destiny. They're the blueprint with which we were made, but we can actually alter gene expression through what we do.
Awesome. And just for those of you who are watching, Dr. Kourosh, she's trained in pediatrics and allergy and immunology at Baylor College of Medicine, and she's also in the local area, so at Texas Hospital. I didn't know that. I didn't know that.
I am, and I started my own practice here in 2022 in South Lake, Texas. Wow. So in the Grapevine South Lake area. And so I'm accessible to all of DFW, but I also see people all over Texas via telemedicine, and not just Texas, but I'm licensed in 4 states, including Washington State, Utah, and Arkansas. So I see patients in the other states in which I'm licensed as well, via telemedicine.
I don't know how you have time to do all of this. You're a yoga therapist, you're a clinical hypnotherapist, you have training in Ayurveda, you have research background in microbiome and food allergy. You're also the clinical. A lot of my guests never talk about who they are. I just want to let you know you're a big deal. Serves on clinical faculty of Seattle Children's Hospital and the Arkansas College of Osteopathic Medicine.
That's right.
So I love what you do. Now, why do you do what you do? What was with allergy? Why did you niche down to allergy immunology? Why that?
Yeah. Yeah, that's such a great question. When I was studying pediatrics and I was in residency, I was really attracted to immunology and allergy, and even had allergist mentors in medical school. And I really loved how the immune system had its fingers in every pie. It's like got tendrils in all the systems of the body. It interacts with the neurological system. There's the neuroimmune axis. There's the gut immune axis. A lot of our immune system exists in the gut. And so there's that tie-in with the intestine and the interface with the environment. And even I loved how the immune system is the first system in the body that learns. So even when we're in utero, inside our mother's womb, the immune system begins to learn how to tolerate things that are self and to protect against things that are non-self. So learning begins with the immune system. Human learning, which I think is one of the main things that makes us an intelligent, civilized species, is learning. Our immune system starts to learn before even we are conscious of being an individual being. So I loved all of those aspects of the immune system. And then there was the personal story. I personally struggled with allergies and asthma growing up, and with food allergy as a young adult. I was diagnosed with food allergies, and it kind of unlocked and solved a lot of mysteries of why I was so sick and why I had such terrible asthma, because it was linked to my food allergies. And then my nephews who were born, I have 4 nephews, and they've all struggled with allergies, food and environmental allergies. So I had this family connection to the field of allergy, and that we were patients, seeking treatment. And after I finished my master's in public health and I was out in practice and working as a hospital physician, I saw the extreme cases of immunological dysfunction. And I worked with the liver transplant team on transplant immunology at Children's Medical Center, Dallas. And I was seeing so many aspects of it that it just fascinated me. But finally, what led me to return to fellowship is that I was, reading medical journals about allergy. And I found some amazing research that showed that the microbiome is so tied into the risk of developing food allergy. And so for years, I would talk to allergists at meetings about this, at medical meetings, when we would go to conferences. And I would say, there seems to be a link in the microbiome. There was this study that if you have more antibiotics as an infant, you have a higher risk of food allergy. Why isn't this research being done? And they would say, interesting, and they would treat it like a fascinating idea, but no one was doing the research. So finally, I just said, I have to go back to fellowship and do this research myself. And that's what I did. I went back to fellowship and I did a study I got trained as an immunologist. And I did a sibling study on siblings who one of them had food allergy and the other didn't. Some of them were twins. I had 4 sets of twins in my study, but also just siblings that were not twins. And I was interested in finding out how someone who shares half or more of their genetics with someone else and was raised even in the same environment, what are the factors that lead to one person developing food allergy versus another? And we knew that there must be links in the microbiome, because the microbiome is key to learning to tolerate food. Like a robust, normal microbiome helps us tolerate a variety of food and digest and use all of that food. And so I did that study, and we did find some significance. And right as I was entering that field, it became this rage in medicine. And now the microbiome is in so much research, cancer research, not just immune system research, but all kinds of psychological research and sleep research is showing microbiome impacts. So that's what was the fascinating turn of events that led me to finally take the plunge 10 years after graduating from residency, go back to fellowship, sort of a late or mid-career fellow, which was kind of unusual. I was older than all the other fellows who were first graduating from residency. And but that actually gave me a great perspective, because I was out in practice as a pediatrician for years, and I knew what were the questions that needed answering, the clinical questions that needed answering. And I also had a public health background. So I did a food allergy and public health research study and implementation in the school system in Houston, where we trained nurses how to recognize and identify and treat food allergy and food allergic reactions and how to educate staff. So I just felt like there was a lot I could do as an allergist that I felt really passionate about. And that's finally what led me there, is to do my fellowship.
I love the holistic approach that you take with the patients, and that you actually immerse yourself in all the data so you can better help your patients. So let's get right to it. I have people who are watching who are like, yes, I've met with my doctor. They're thinking allergy shots because she's not doing so well, or he's not doing so well. He seems to struggle in and out of school. What are other options? And we can talk because some people are watching who are like, well, I may not get to see you, but are there other things I should be asking my doctor that could potentially help my child with that seasonal allergies?
Yeah, for sure. Before I even offer allergy shots, I make sure that we've exhausted the non-needle related interventions, right? Because allergy shots are a big commitment. Not only are you facing an injection, a shot, a couple of times a week for a few months, and then spacing it out to weekly and every other week and eventually monthly. Not only is it a big time commitment, especially up front, but a big cost investment. And also there's the needle, right? And there's also the risk of reaction. So there's a 1% risk of severe allergic reaction during the course of allergy shots, which doesn't seem like much of a risk, but if you span it over hundreds of shots, then it becomes more of a risk. And also if you span it across thousands of people. So there, first I tell people we have to test. Test, don't guess. Know what your allergens are. If you sort of suspect something, but you may be assigning it to the wrong thing. Like someone was saying that he thought that he was allergic to his dog, but he loved his dog and he didn't want to get rid of his dog. So we tested him, and lo and behold, he wasn't allergic to his dog, but he was allergic to dust mites, and the dog bed was harboring dust mites. So we changed the dog bed and covered his mattresses and his pillowcases, and his allergies vastly improved without shots. So there are environmental things that you can do if you know what your allergens are. The other things that are like very common sense is I tell people to rinse with saline spray in their nose, and I teach them how to do it. And some people use the neti pot or the big rinse bottle, but even the small saline spray done frequently can actually make a big difference in the experience of allergies. Then there are medications, over-the-counter medications that are very safe that we can use. Also prescription medicines that are pretty safe that we can use, and might discuss those with people. And some people opt for the medication route. And others come back to me and say, get me off these medicines. I'll take the shots as long as I can come off these medicines. And then I also do the supplement route. So depending on what your nutrigenomic profile tells me and what your body systems need, I can prescribe specific supplements. And there are wonderful anti-allergy supplements, which for the people that those supplements agree with them, work very well, like fish oil, vitamin D, and quercetin, just to name a few. Although I would, the doses and the delivery way and all of that would depend on the person and what kind of system they had and what their needs were. And again, I make sure that we know what your vitamin D levels are. And so fish oil or omega-3s make a big difference in immune system tolerance and immune system function in a lot of people. So those kind of supplement routes are there. And I've had people just eliminate environmental allergens, get on the right supplement and medication profile, and not really need shots. But then there are the more severe cases. And then just, if people don't want to do the needle, there are sublingual allergen immunotherapy options. And that means that we can either use the pills that are FDA approved that dissolve under the tongue that contain specific allergens and over time desensitize people, or we can do formulated serums specifically for them based on the allergy testing that we did to help them get desensitized to their allergens. The drops are actually a great option, but you have to be very compliant, as in you can't miss days. You have to do it every single day. So for some people, the shots are a better option because eventually they're just going once a month. Whereas the allergy drops, for the entire duration of years that you're using them, you have to make sure you do it every day, whether you're traveling or you're sick or what's happening. I mean, sometimes when you're sick, we'll back off for a few days, but most of the time we have you power through and do the drops. So those are options that are out there. And what that does is teach your immune system little by little that this pollen or this dust mite allergen isn't actually an invasive threat, and you can relax and not react to it. So that's what the immune system training during immunotherapy is about.
Okay, let's talk a little bit about the nutrigenomic genomic testing. For those who are watching, who are like, wait, can you speak more to that? Is it something that's relatively widely available? What would you say to that?
It is. And for those who've already done, say, a 23andMe or an Ancestry kind of test, because a lot of people have done that, that does tell you some things like about your heritage. But although they've sequenced your genome, there's not really correct interpretations or ways to interpret the data, the raw data that they have, unless you go through an additional profile step, which is called the stratagene analysis. So that is something that people do, and they pay an additional $150 and we get a file with their nutrigenomic data. But I actually use other platforms that are clinically geared, and clinical genomic testing is different from the ancestry types because it actually looks at actionable gene variants and how we can treat them through lifestyle, diet, supplementation, sleep cycles, and other kinds of interventions like exercise. Like, for instance, there are genomic variants who, the CrossFit, like high intensity interval training isn't right for them. So their doctor may say, go exercise and try to lose weight. And they go do that and they just gain weight and they feel terrible, but if they do moderate intensity exercise and weight training, they actually lose weight. And through nutrigenomics, we can figure out what's the right exercise plan for you as well. So that's what's great about it. The other is that it can actually help understand what your predispositions are towards certain diseases. And if we know what those are, then we can actually screen early and catch diseases like cardiovascular disease or autoimmune disease early. So that's what's really helpful. But when people usually come to me and want nutrigenomics testing, it's because they've hit a wall from the perspective of treatment. They've gone to other doctors. They don't really know what's wrong with them. And then we do the nutrigenomics testing, and it helps to unlock some mysteries. And we understand then why this supplement that seems to be good for everyone else is actually making, and helps other people feel calm, or why this person who was told that green tea was good for them whenever they drink green tea has, a sense of panic or agitation. So we don't know why one thing is good for someone else and another thing is good for another person until we unlock that genomic data about how things are processed in the liver, in the brain, in the gut. And that's what the nutrigenomic data tells us. It's about metabolic and inflammatory pathways, and also histamine processing, which can be a big part of allergies. So histamine is a molecule released by an immune system cell called the mast cell. It's what's responsible for that big welt when a mosquito bites you, or hives when you have an allergic reaction, or lip swelling when someone has an allergic reaction. It's all due to histamine, but histamine is processed in different ways in the body. And if one of your histamine processing pathways has been impaired by a mutation, then we can help it along, make it more functional, or give you supplements that help absorb and digest that histamine and help you with your allergic inflammation or even handling food allergic exposures.
I'm really thankful that you do this. I think I'm familiar with Nutrigenomics. I think that's one of the companies that tend to do that too, and almost like pharmacogenetic testing too, where you can find tailor and not guess your way to the ideal treatment for a patient. Now let's talk for someone who's saying, well, all of this sounds nice, and I'm not sure I can get access to this, in that, maybe my doctor doesn't do this, and so they're trying to connect with you, doc. Where can people find you?
So you can find me on Facebook at Holistic Allergy and Immunology. That's my practice page. I also do a lot of informative Facebook posting on my own page. Atoosa Kourosh, and my own name. And I also have a couple of other pages, a healthy kids page and a holistic pediatrics page where there's some blogs and commentaries. But the best way to find me is just through my website, which is the word doctor spelled out, and then my first name, Atoosa, Atoosa. So if you just go to dratoosa.com, you'll find all of what I do there, including some information about nutrigenomics and hypnotherapy and yoga therapy. So it's all there. And I just combine all of my training and all of my modalities that I've studied into treating my patients. So when patients come to me, sometimes they'll come to me for a very specific thing, but they get the benefit of all of it if they're open to that.
Awesome. I like it. So you have multiple options, not just allergy shots where you meet with Dr. Atoosa. Now, you have a book. I saw that.
Yeah, I have a book that's in development that I hope to publish in the coming year. It's called Doctored Desserts, and it's a healthy cookbook. But beyond having healthy dessert recipes in it, as in they're doctored, I'm a doctor and I doctored these recipes to make them healthy. So beyond that, I also have the Doctored Desserts website, drdesserts.com, which has the preview of a lot of my recipes and some videos of how to make them. And I'm developing this book, and it's not just recipes. So there are about 30 recipes, but in addition to that, the first 5 chapters of the book are to help you understand the role that a particular thing like flour or sugar or butter or whatever plays in the recipe, so that you can understand how to create recipe substitutions of your own. So you can take your grandmother's favorite dessert recipe and adapt it into something that you can eat and it's still healthy, or your child with food allergies can eat. And I started this so long ago because 20 years ago, if you were allergic to wheat or dairy, which I am, you couldn't just go out to a gluten-free bakery and get a gluten-free cake. You had to bake it. You had to figure out how to make it. So through a lot of experimentation in the kitchen, and I've been a cook since I was little, like I was helping my mom in the kitchen when I was 3 and 4. I was one of those underfoot in the kitchen babies. So I had a lot of cooking and baking experience, and I put all of that experience and what I knew scientifically and nutritionally into play to create these recipes. So they're all gluten-free, dairy-free. Most of them have a vegan version or can be made without eggs. I have an egg substitute, recipe that's made with tapioca starch that's very easy to make, and people can do it themselves. And all of that, those tutorials are in the videos as well. So I think this is going to be a beautiful book, but until the book comes out, my website is there so that you can get a preview. And also my YouTube channel is there, which you can access through any of my websites where my recipes are. And also some yoga practices are on my YouTube channel, some breathing practices. So my YouTube channel is sort of a smorgasbord of everything I do, like a little sampler. But the website, drdesserts.com, you can find my recipes and my videos there. And more come out every couple of months.
And I've put it.
And I have my collected. I just have to, write the first 5 chapters, which I'm working on, and find a publisher or possibly self-publish. So I'm still working.
Awesome. Keep up the good work. What you're doing is powerful. You're telling people that there are options to enjoying food in a way that's not toxic to them. I love it. So I put that information at the bottom of the screen here, both on Facebook and on YouTube. Dr. Atoosa, thank you for coming and sharing your wealth of knowledge.
My pleasure. With Dr. Desserts, our catchphrase is "have your cake and eat it too," because you can't be healthy and still have dessert, but you can.
I love it. Thank you so much for coming, and thanks to all who watch live and replay. I appreciate you. For next time, put a comment. Let me know you're here so I can give you a shout out too as well. I see you, Mrs. Deflock, but thank you for joining. Dr. Atoosa, I really, really appreciate you. Maybe we could do this again, maybe in 6 months. I
would absolutely love that, Dr. Oliventon. Thank you so much for hosting me. And thank you for what you do to bring holistic health to the primary care setting and down there in Mansfield.
Thank you. And for you all who are watching, as always, caring is sharing. Please forward this. You can comment in the link on the post or the comment section and tag your friends. Forward it to those who will find this useful. And as always, if you or anyone you know is looking for a thorough and awesome, a passionate, and a a convincing family physician who will have conversations to help you live long and well. I am she. Have a good one. Thank you again, Doc. Have a good one.
Thank you so much, Doc.